Everyone, welcome back to Epworth Clinic's second go at doing a Facebook Live chat. This is part of our series as part of Mental Health Month. Hopefully some of you saw the interview we did last week about what's the elephant in the room and asking some of those difficult questions. Well, today we've decided to do something a bit different, which is a bit more around day in the life. So what's it like as a patient when you come into our inpatient ward and our outpatient ward? So my name's Maya, I work here at Epworth Clinic, and today I've got two of our great staff members with us. So I've got Carla, who's a social worker, and Rosie, who's one of our clinical nurse educators. So what we're going to do is ask some questions that we get asked all the time, and hopefully you'll have a bit of a listen. If there are things that come up that you're interested in, feel free to send us messages on our Facebook page and we'll try and answer them either right now or at the end. So I'm going to kick off and actually answer my own question, which is one we get all the time, which is around, well, what's the difference between being an inpatient and being an outpatient? So inpatients for us is when things are kind of really unraveling for you. So it might be a time where you really need a bit of extra support, and actually the best place for that to happen is in an inpatient ward. So that's when you come with us and you actually might do an overnight stay, and that could last for a whole different range of time depending on what's going on for you. Whereas some of our outpatient things are a bit different. So outpatients for us are day programs primarily, and that's when you might come in once a week for a 12-week course. And a lot of people have heard of things like cognitive behavioural therapy or mindfulness. So you'll come in for a few hours every week, but then when you're not with us, you're actually probably at home doing all the things you normally do. So going to work, looking after your family, socialising. So depending on what's going on for you is which one's going to be the better option for you. All right, so I'm going to throw across to Carla and ask her the first question, which is, what does a normal day look like when you come into Epworth Clinic as an inpatient?
Pretty simple, actually. We run a 7-day therapy sessions that run for 7 days, sorry. So obviously the goal around your stay at Epworth is that you attend the sessions that we offer here as part of your recovery goals. So we're very recovery oriented and goal focused. So we run those throughout the day, and they range from really practical groups to more therapeutic intervention type groups. You know, there's opportunity to mingle with other patients and, you know, form connections with them as well. We've got a number of facilities that you can use here. So it's all pretty, you know, pretty standard with, you know, therapy being the main goal that we drive you guys to participate in.
Excellent, thank you. And I guess you mentioned that there's kind of therapy programs. So who is it that through my day I might have, if I'm coming in, so am I going to be seeing nurses? Am I going to be seeing social workers like you? Who am I going to see maybe during my day?
Yeah, so it really does depend on individual cases, but in general, you are primarily taken care of by the psychiatrists.
Yep.
You've got a team of psychiatric nurses as well that are heavily involved in your stay and your care here at Epworth, and then there's a number of allied health team members that comprise of social workers, OTs, psychologists,
yep,
all of which, you know, will be involved at some point in your care.
And I mean, I can't say that I've heard this because I know that this exists, but I know that there's one very special team member that gets a lot of attention during our week, and I wonder if people might be interested to learn a little bit about Jasper.
Yes, so I was just going to say, I assume you were talking about Jasper the dog. So we do run a therapy session called Pet Therapy, and that's exactly what it is. We bring Jasper, who's an adorable, I think he's a cavoodle?
Or black Russian Terrier, I think, officially.
Black Russian Terrier. He comes in once a week, and it's a really casual setting where you just get to interact with him, play with him, have some one-on-one time with Jasper, and it's just really laid back and quite nice to just sit and chill with a really gorgeous dog.
Yeah, I was about to say very popular for us.
Yes, very popular.
Thank you for that. So you mentioned that we do kind of different therapies. So what might it look like if I come to a group? Like what might be one that's going on at the moment while we're in here doing this interview?
So for example, like I said, we run really practical groups, and also your more cognitive behavioural type therapies that people might have heard of. So we range from doing like art, we do you know, life skills, so therapies around or sessions around teaching you how to budget, how to do goal setting, We do other groups around talking about emotional, more the emotional type stuff in terms of your recovery, but it does range from practical to more cognitive type
and
therapies.
I know that one of the things people often are interested in when they're with us is what's it going to be like when I get home. And so if I come to a group while I'm here, am I going to potentially do some, say, relapse prevention planning or discharge planning? Like, are those the type of things I might do?
Absolutely. We absolutely run discharge planning groups every week to ensure that you are headed in a direction that's going to facilitate a really smooth transition from home, from hospital to home. So very practically based, looking at what goals we want you guys to be focusing on in terms of your recovery and the journey that awaits you for when you are discharged from hospital to home.
All right, thanks for that. And I guess being in an inpatient ward isn't just about me. There's other patients that'll be around. So am I going to be spending time with other patients? Do I have to spend time with them? How does it work?
Well, absolutely. In a therapy type setting, which is what we encourage all of our patients to kind of work towards whilst they're here to take active part in their own recovery, you will be spending time with other patients. There's, like I said, also the opportunity to be with other patients in facilities like the lounges that we have around the hospital. But again, outside of group therapy sessions, I'd say that that's probably more up to the patient, depending on what, how active they want to be with other patients. But definitely encourage you to connect with one another whilst you're in here and to
hopefully learn from each other.
Yeah, that's right.
Thanks for that. I'm going to throw across to Rosie, who has been out of the firing line so far. So I guess one of the things in thinking about that is like, what does my actual space look like? So I come in here, what does my room look like? What's in it? What does it feel like?
Yeah. So we're very, very lucky that at Epworth Clinic we have a pretty much brand new facility. All of our rooms are single rooms with an ensuite. You have your own private TV, you have wireless as well, which is pretty popular if you want to bring in and watch your own Netflix and things like that. But yeah, so you've certainly got that, I suppose, environment to be able to go back to your room and have that space, which is really important to have that time to reflect as well. Yeah.
And I know one of the things people often ask us about is like kind of how does it work with meals here? So like what's the food like? How does that work? Do I order it? Does it just come? How does it work?
Yeah. So throughout the day there's scheduled times when the kitchen dining area is open and patients make their way down to the dining room. Between those times there's fruit and snacks available. There's also a vending machine available as well. But if you do get hungry between times, the nursing staff can facilitate extra food. In terms of what the food's actually like, so we do have fresh fruit, cakes as well, if it's those kind of between meal times. But usually there's a hot option for food. With a vegetarian option, we can cater for other more specific dietary needs as well. So if you just let us know when you get here, we can facilitate that, as well as a cold option with sandwiches and salads. And that's for all meals, having both options there.
All right. And I guess one of the things that interests me is like in most hospitals, you kind of, your meal gets brought to your room and you kind of eat by yourself. So is it kind of purposeful that you have to eat all together?
I think that it's important to be able to socialise with other patients while you're here. If you do find yourself staying in your room, it can be quite isolating. So it's good to be able to get up and go and do something, and you can structure your day around meal times. When meals aren't on, you'd be attending groups. So it's quite structured in that way, and it helps people develop a routine to be able to get back on their feet. Often from a period that's been sometimes quite chaotic at home.
All right, that's really great to know. And Carla, what are some of the other facilities that are available on site? So we've spoken about that there's kind of group rooms, which is like what we're in, where we run our groups, and there's the dining room and stuff. What are some other spaces that we have on site?
We've got a number of other different spaces. So we offer a communal lounge where you can play board games, there's books, and There's other areas where we offer like a communal TV where you can watch some of the DVDs that we offer here at Epworth. It's just a space to encourage, interaction with one another. We also have the dining room, as Rosie said, where our meals are served, and we also offer laundry, so you can bring in laundry if you find that you're here for an extended period. You can do your laundry here.
All right. And Rosie, that kind of leads on to a question I've got for you, which is like, what are some of the items or the things I can or should bring in with me if I'm coming in for an overnight for a period of stay?
Yep. So make sure that you take what you would if you were going away for any period of time. So bring some clothes. Make sure you bring some appropriate footwear to wear around, just to protect your feet. You can bring your laptop or iPad to connect to the Wi-Fi. If you need any medications, you can bring those in with you, and speak to intake as well if you are unsure of whether there's something that you should or shouldn't bring in. Often people try and make their rooms a bit more like home too, so if you have a doona that you'd like to bring, or a blanket, or photos from home, absolutely more than welcome to bring those in.
That's a great idea. And I guess I'm just interested around the medication. So if I come in and I bring my own medication, when I come up to the ward, should I give that to the nurse that I'm meeting with, or what should I do with that medication? Should I let you know?
Yeah, so when you get here, you'll be met by a nurse who will show you to your room and have a talk about what's going to happen for that day for you, because it's always a little bit different, and then you'll give them your medications and anything else that we might need to support you while you're here.
All right. And what about visitors? Because I guess if I'm here, and we said we might be able to socialise with other people that are on the ward, but what about people from my own life, family or friends or partners? What?
Yeah, so you absolutely can have visitors come in. We kind of try and tailor that to what will best meet your needs. So the group program is very important to be attending, to make sure you meet the goals of your recovery. So we try and work it around attending groups, but absolutely people can come and visit.
All right. And so if I wanted to, say, have someone come and visit a particular time, I could chat with my nurse about that, or?
It's best to let us know about what's happening, and we'll work with you depending on what your needs are.
All right. And I guess that's pretty similar, because I guess the next question I've got is the opposite of that. Instead of people visiting, like, can I go out on leave? Like, can I just walk out of the hospital, or how does that work?
So everyone's here for a different reason. So what we want for you, and what you often want for yourself, is to ultimately be safe. So if we feel and you feel that that's something that you'd like to do that will help your recovery, and it's safe to do so, then absolutely. And that will be decided between you and the team and the psychiatrist here. So
I guess one of the things, I wonder if it's a bit like what you were saying around having visitors. So if I want to go on leave, I'm going to probably be told about, like, can I do it by myself? Do I need to have a family member with me? And also, do I need to tell someone on the ward when I'm going and when I'm coming back? Like, how does that work?
Yeah, so when you get here, the plan will be made as to what that will look like for you, and you'll know about whether it's okay for you to go out by yourself, but absolutely anytime that you want to leave the ward, speak to the nurses, just so that we know. There's nothing worse than us thinking that someone's gone missing and calling you, and you're just out having a nice day in the sun. So good to work together that way.
And one of the things that we didn't pick up on earlier, but I know we were chatting about before we started this, was around some of the more kind of lifestyle interventions that we do here, because I guess we're pretty clear at Epworth Clinic that your mental health and wellbeing is the whole picture and a holistic model. So I wonder if either of you are happy to maybe talk a little bit around, like, our MOVE program and some of that stuff, and what's available to people when they come on the ward.
Yeah, absolutely. So we do run a MOVE group, as you've mentioned, and that's run by different allied health team members. So it is sort of the group that connects mind and body, and it's run by dietitians, social workers, OTs. We utilise the gym that's on the ward, trying to get you kind of out of the common space and get you to be a bit more active.
Yeah.
So like I said, incorporating mind and body and wanting to really emphasise the importance of physical health as well as mental health. So.
And so is that, because I know that one of the people who runs that for us is an exercise physiologist, so that's kind of her very specialty is around kind of, because we talked earlier about goals of kind of therapy and symptom management and relapse prevention, but really she's the one who'd work with you on what are your goals around exercise or around how do I then do that in the community and stuff.
Yeah, just like the dietitians are, you know, the primary team members that work with you around goals for eating and lifestyle changes around meals and things like that. That's the exercise physiologist's role.
So we've come to our last question on the piece of paper, at least, and I'm going to close up that question in the same way I got to open it up. So one of the things we get asked all the time is like, how long am I going to be in for? And that's a really hard question, and so I'm going to be a bit annoying and say it's that kind of thing of like, how long is a piece of string? Because I guess what we know is that everyone's experience is really different, and some people might come to us only for a brief period where it's more, say, crisis driven and they just need a bit of support for a shorter period, whereas some people really things are kind of going not as well for them and they need a much longer period with us. So I guess that's something that we'd always encourage you to have a talk with your treating psychiatrist about, or your GP if you're in the community, and really to, I guess one of the main things, and we often talk about this, is that the more engaged you are in your care and attending groups and doing all of those really good protective factors, and if anyone watched the video last week, we spoke a bit about protective factors in the stress bucket. Those are the things that ultimately are probably going to influence some of that. But ultimately, I guess one of the things we're pretty clear about here is that hospital is here to support you when you need it, but ultimately life is where we want you to be, and we want you to be in the community doing all those things. So we're hopeful that we always work with people to make sure that we get a good balance between both of those. All right, so I think that's probably it from us. We're going to wrap up. First, let me thank Rosie and Carla for joining me today. Thank you for anyone watching out there. We really appreciate you coming into our space and being able to share it with you. As I've mentioned before, Epworth Clinic is really trying to kind of connect with you and through Mental Health Month. So please feel free to like and share this video. Make sure you like our Epworth Healthcare Facebook page so you can see the next one, and the next one will be coming up, and you'll see some information on the website, and we're actually going to take you through a mindfulness practice with one of our other clinicians. So thank you very much for your time today. We really appreciate it.